and they're spread out over those counties. We have basically 3 divisions. We have our administration division, which they do vital records, so birth and death certificates. They also they help they kind of help support all of our other divisions as well. We have an environmental health division. Our environmental health, they do a whole mess of things. They, pardon me, they do everything from biosolids, which is a product that is spread on farmland for fertilizer. They do body art. They do water safety. That would be like testing well water. We don't test for a ton of very specific. We test for total coliform and E. coli at the health department. If somebody wants further testing, we send it to Weld County. Weld County's lab is a lot bigger than ours, and so they do that testing for us. We do inspections of child care centers. We do all the retail food safety, so any retail food establishment, food truck, school lunch program, all of those, we inspect those. We do on-site wastewater treatment, so any septic systems that need to be installed or repaired, those are inspected through our department. We have a consumer food safety program. We also do some information about pool safety and radon. We also take care of all of the zoonotics, so anything like West Nile virus or rabies, and that definitely going to do a plug for rabies. Please get your animals vaccinated. We've been dealing with rabies quite a bit in the last week. We've had 2 positive animals with rabies, and so we've had to recommend post-exposure prophylaxis to some individuals that actually came into contact with those animals. So please be sure to get your pets vaccinated, and don't touch wild animals if you can help it. So that's kind of our environmental division. Our other division is our largest, and that's our client health services division. And in that, we have programs like WIC, which is our supplemental nutrition program for women, infants, and children. And then we also have our family planning services, as well as immunizations. And then we have, pardon me, we do communicable disease investigation. So that kind of gets into COVID, but we also have to investigate other reportable diseases. So like salmonella, Campylobacter, E. coli. We follow up on all of that. Hepatitis A. There's a pretty long list of diseases that we need to follow up on. So we take care of that. We also deal with like West Nile virus. I think I've mentioned that. So yeah, we've got a whole host of diseases that we normally do follow up on, tuberculosis, that kind of thing. We also have some funding through the Maternal Child Health Block Grant, and with that, we do a program called the Healthcare Program for Children with Special Needs. So we do some kind of case coordination for families that have got kiddos with special needs, whether it's a physical disability, mental need, or behavioral health. We assist with that, just helping parents to kind of navigate those health systems, because they can be really confusing. And so we have nurses that are available to help them with that. We also provide specialty clinics for those kiddos that we've been doing some via telemedicine, and then we also have some physicians that come up from Children's Hospital to provide services in our Sterling office and in our Fort Morgan office, so families don't have to travel all the way to Denver to get those. We also do Healthy Child clinics, which are a screening clinic, and those are for kiddos age 6 months up through the age of 5. And we screen for social, emotional, behavioral, height, weight, developmental screenings. They get a dental screening. We check hearing and vision, and those are at no cost. And we do those at least once a year in all of our counties. Some of our counties we do them a couple times a year, and so those are another thing that we offer. We have child passenger safety, like car seats. We provide some information to people. Our WIC staff are all able to help families to install their car seats correctly and make sure that they know how to buckle their kids in, and so we provide some help with that. We also have an oral health program where we work with communities with like their dentists or dental hygienists to go into the schools to do oral health services with sealants and also with screening and education, teach kids how to brush their teeth and the importance of oral health. We do have a tobacco cessation program that we do a lot of work with schools on, as well as just in the community, and providing information as far as what the laws say about, how far back you have to be from an entrance to smoke. If people want to quit tobacco, what are some resources that are available to them, and trying to get them connected with that. We have another program called Communities that Care, and currently that's in Logan County and Yuma County, and working with the schools to provide some evidence-based programs for school-age kids to kind of increase resiliency and provide them with tools to make good choices. And then we also have an emergency preparedness and response program that has been really busy lately, because that's how we've been running our COVID response. But we have that program as well. So our website's got a ton of information on it if people have questions about specific programs, but that's kind of in a nutshell, sort of the things we do when we're not doing COVID, or the things that we do in addition to what we're doing when we're doing COVID. Because like with the rabies, we've had to contact people and make sure that, check out their exposure risk, and then if they need to get post-exposure prophylaxis, then get them connected with the right provider in order to get that resource. We still have people putting in septic systems, so we're still inspecting those and helping with plan reviews on that. So, we're still doing the stuff that we normally do, but we're just doing COVID as well. So, but overall, I think if you go to our website, we've got some good information on there for what things are looking like in our region. As I was talking with Kathy before we started the call, we've got a couple of people working really hard to get good data on our website, just so that people kind of understand how things are going. For a long time, all we had were cumulative case counts, because that's basically all the capacity that we had was to put those up on our website. We just didn't have enough people to really look at the numbers and analyze them. We were able to grab a former NCHD employee that had worked for us a few years ago and had gone overseas and joined the Peace Corps, that kind of thing, and came back, and we were able to snag her for a while. And so she's been instrumental in helping us get our data up and going, as well as our Director of Client Health Services has also been really instrumental in getting our data really refined and making sure that it's accurate, and that we're displaying it in a way that is understandable but gives you some good information. So we've been working hard on that. Out of the 6 counties that we currently serve, 4 of them have variances, so their guidelines are a little bit different from the states. So we try to assist, like with restaurants or other entities. We try to assist them if they've got questions. A lot of times we'll refer them back to the counties because it's the county specific variance. But if it's things that have to do with like retail food, we do that anyway. So we try really hard to give them the information that they need, and also try to be creative about how can we make these guidelines work in a way that is easy to follow. So we've all learned a ton in the last few months about things that we never thought we would be working on. I've got staff that are really well versed now in like public health orders and guidance that before February, they were doing like tobacco cessation. So it's been a really big learning curve, but I think our employees have stepped up so much and are doing a great job. So, so yeah, I don't know if you have specific questions about the COVID response. I would be happy to do my best to answer those.
Okay, and as you guys have a question, if you'll kind of put it in the chat box, and then I'll call on you and we'll get you unmuted. One of the things I noticed last night on the website, Trish, was that you now have another category of having it broke down a little bit more as far as cases go. So as we look at Morgan County with, I think we were at 636 cases last night and 45 deaths, if I remember correctly.
Mm-hmm.
But then when I went into the Morgan County figures, it showed only 50 active cases.
Mm-hmm.
I think that's an important number. I keep seeing we were going up 20 a day, 25 a day, and then it was 15 and 10, and now it really has slowed down to 1 or 2 a day. But the active cases is almost a better number to look at as far as how it's still spreading in the community. Are you seeing, because I know Morgan and Logan are 2 of the hottest spots in the state, and I know Logan's is more because of the prison in Sterling. That's where a lot of the cases are. Morgan is more community spread. Are you seeing those numbers start to come down as we're out and moving around more?
Well, I'm not, this isn't going to sound right, but I'm not sure, because we've only been moving around for a couple of weeks now, and we know that a lot of times those big data curves and stuff take a couple weeks for us to really understand. I can say I'm very thankful that our cases have continued to decrease. I am super thankful when we have, new cases in like the single digits for Morgan County, and we even had one day where we didn't have any cases. And so I was very happy about that. I think that I'm hopeful that as people get out and move around more, that they'll still continue to be really mindful of social distancing, and if they're going to be in an enclosed space with another person that they're not normally around, that they both wear masks. I think that I know that there are people that have very strong feelings about masks, and I can tell you from a public health standpoint, the purpose of the mask, like the purpose of this mask that I have on, is so that when I go out in the hallway to where my coworkers are, I put it on to protect them from me, and they have their masks on to protect me from them. It's basically, I'm respecting my coworkers because I'm keeping my droplets to myself. We know that COVID-19 is spread primarily through droplet transmission, and whether or not we like to admit it, we all have droplets that come out of our mouth when we talk, when we sing, when we laugh, when we sneeze, when we yell. We all have stuff that comes out of our mouths. Usually it's pretty small and we can't see it, but it's still out there. So a mask pretty much just keeps all that to ourselves. And it's so important now as people aren't moving around, because we know that with a lot of a pretty high percentage of cases that have tested positive, I want to say around 30% have been asymptomatic, and that is concerning from an infection control standpoint, because when somebody normally gets the flu, they feel rotten and they're going to stay home because they just feel terrible. Well, with COVID, you may not feel rotten. You may not even realize that you have it. So you may go out and about and do your normal thing. But if you're not wearing a mask and keeping your droplets to yourself, you could be spreading it to a whole bunch of people, and they may not end up being as asymptomatic as you are. They may end up, in a hospital. They may end up really seriously ill. And so that's the reason why we're really pushing for people to wear some kind of face covering when they're out and about in in stores or at church, when they're going to be with other people that they don't share a household with, we really ask them to wear a mask because we want to make sure that no one is inadvertently spreading something. So,
well, now I have a new slogan. Keep your droplets to yourself, wear a mask.
there you go.
As somebody who is in the older age group and with an autoimmune disease, and I'm going on 90 days, which my car told me this morning because it wouldn't start. The battery's dead.
Oh no!
So you can tell I've not been going anywhere. But I wish they would wear masks, that we slow this thing down so that we can get back to some type of normalcy.
Mm-hmm.
Any questions from anybody on the call? I see we have Patricia Brewster Wilkie again from Ireland on the call. Trish, you remember Patricia?
I do. How are you, Patricia?
I'm great. It's lovely to see you.
Oh, it's good to talk to you.
I mean,
And
we're
in fact, today in Ireland, the restrictions were just lifted slightly. The Prime Minister announced at 2:00 this afternoon. It's 5:00 in the evening here, by the way. And so I was particularly interested in your call, and we were disappointed that they're only making masks advisory in Ireland and not mandatory.
Mm-hmm.
So
Yeah.
anyways,
I have my Pro 15 mask, so I wear it out and around, even in the yard, because I sit on a corner and the sidewalk is pretty heavily trafficked with people walking. So when I'm out in the yard, I put on my mask just to be on the safe side. Linda, Kurt, Jack, Melanie, Ron.
Kathy, I do have a question.
Go ahead, Kurt.
Trish, good to see you. Thanks so much for everything that you and your team are doing. I know that there is a variance that has been drafted for Morgan County, and it specifically says that everyone is being encouraged to wear masks, but I don't find that to be all the case. And I'm wondering if the lack of compliance around mask use would be something that would prevent us from getting a variance.
I would doubt that it would be something that would prevent Morgan County from getting a variance. I think that there are a lot of places that, because there's really no way to track that or to gather data on. I mean, I guess you could, at a certain point in time, at a certain location, you could see how many people were wearing masks and potentially, I guess, extrapolate from that, but that is data stuff that's way beyond my capabilities. So I don't think the lack of people wearing masks would necessarily prevent Morgan County from getting a variance. I certainly hope that with more and more people moving around, the lack of masks would not cause an increase in cases. We certainly hope that won't be the case.
Thank you.
Ron, I see you have a question.
Oh, yes, I'm sorry.
That's
Ron's
all right.
question is, have there been significant improvements made in treating COVID-19? Is that affecting the severity of symptoms? Actually, from what I understand up to this point, there aren't any additional treatments. I think they're getting a little bit better at, because some of the information that I've seen is that when people are intubated, they're put in like a posterior position, so they're actually laying on their tummies, whereas traditionally you would see somebody on a vent on their back, but they're having them in a posterior position because that is more helpful to them. As far as we don't have a good treatment for COVID yet. We don't. They're working on it, but I haven't heard of any other potential treatments out there that are kind of like for influenza, we've got Tamiflu and Relenza. I haven't heard of anything like that for COVID yet.
One of the things that I noticed is, do we have, are we doing any contact tracing in our region to try to narrow down like I think, pretty much Ebenezer got hit really hard, really quickly. Have we done that contact tracing to see where it came in from? A lot of what people I hear is there's hardly anybody out here. I don't need to wear a mask, but it transmits from county to county very quickly.
Mhm.
And so
I would think at this point we are able to make contact with because we get informed of all the positive test results. Our agency does, and so our staff calls everybody on that list and makes contact with them, discusses, how are they feeling, and talks through with them potential exposure locations to see if we could track down where they were exposed. We also ask them, who have you been in contact with? So let's say I get a positive COVID test today, and somebody calls and talks to me. They would want to know, like, when did my symptoms start? And so if my symptoms started yesterday, they would want to know who I've been around starting, because today's Thursday. So starting on Tuesday, they would want to know who I've been in contact with from Tuesday on. And so then I would say, okay, well, I saw my neighbor, and I saw my coworker, and that's all the people that I've been in contact with. So then they would contact my neighbor and my coworker. They would say, we need to let you know that you've been identified as being potentially exposed to COVID-19. If they ask who it is, we don't tell them. We just say you've been potentially exposed. And then we say, what we need you to do is we need you to quarantine for 14 days. And then if they say, well, I can't, my job won't let me, then we say, okay, well, let me talk to, I can talk with your employer if you need. Do you need resources in order to stay home for 2 weeks? Do you have, do you have someone that can go to the store for you? We try to connect them with resources so they're able to follow through with that quarantine. And then they just stay home, and they may or may not develop symptoms. We hope they don't, but then they just stay home, and that's how we stop the transmission. So, yeah, we do contact tracing on all of the positive test results that we're able to contact. We have had people that refuse to call us back. They won't call us back, or they don't want to talk to us. They won't give us their contacts. And so what we do then is we really try to urge them to, we give them a list of things that they can tell their own contacts. They can tell them. It's like, if you're not going to tell me who you've been in contact with, then I need you to tell these people all these things. And, when to go see your doctor. If you want to get tested, here's some testing sites. So we try really hard to follow up on every single positive that we have. Sometimes, I think we have a pretty good chance. Most of the time we're able to follow up, but sometimes people just don't want to talk to us, and I can't make them. Here's a
Ron,
question.
just one last question, and then we'll finish it up for the day.
Okay, Ron's question is, my sister lives in Colorado Springs. Her husband is 72 and has recently developed AFib. She would like for my wife and I to come down to visit in the next few weeks if it could be done safely. Could you comment on the wisdom of doing that? And if so, what precautions would you recommend? Okay, what I would do then, Ron, is if you and your wife have been social distancing and not being around a lot of people, I think you could certainly go to visit, but I would recommend that while you guys are in the same room, that you guys wear masks just to be on the safe side, unless you and your wife want to quarantine for 14 days prior to going, then you could be assured that you weren't taking anything with you and you wouldn't necessarily need to wear a mask. Or you guys could, I don't know if you would just go down to visit for the day. You guys, if you stayed outside, that definitely lessens your exposure risk. It gets kind of hot outside, so I think it just kind of depends on if you can maintain that social distancing, then that's our big thing. And then if you guys wear masks, if you're within that 6 feet of each other, then you guys should be fine.
Hey, Trish, I have a question.
Uh-huh.
You mentioned how during contract tracing you'll call someone that may have come into contact and ask them to quarantine for a couple weeks.
Mhm.
Could they possibly cut that by getting tested?
Not by much. I guess theoretically they could. If they went in that day and got a COVID test and it was positive, then from the date of their positive test result, they could wait 10 days and then be considered recovered, but it's not going to be by much.
Thank you.
Uh-huh.
Okay, and I've got one last question, Trish. In the numbers that we have, will you ever be able to break it down even one step further to show how many people were actually hospitalized?
We are working on hospitalization numbers. That is a little bit harder to tease out from the data that we have available, but we are working on trying to present out of the number of positive we have, this is the percentage of people that were hospitalized, you know, this is the percentage of people that passed away. So we're trying really hard to do that. We just haven't gotten there yet in a way that we feel really good about yet. We want to make sure that the data we're presenting is accurate.
Because I love the part about where we know how many cases and what age range they're in. The deaths, that would be nice to know. So many people think it's only the elderly. And showing the age range from, I think we have one 6 months or something in Morgan County in age, or below 2 years. I don't remember what the number was. So those, as people are determining what they're going to be doing in the future and how important masks are and everything else, the more information we have, I think, will help make better decisions down the road.
Yeah, and we'll continue to put as much information out there as we can. So yeah, thank you. I will take that back to the team.
Well, and I check their website every night after 5 o'clock just to see the latest numbers. I know at least one other person on here does that also, because we compare notes once in a while, but it's what, nchd.org.
Correct.
Okay. Thank you very much, Trish, for being with us today. Everybody have a great weekend, and we'll talk to you later.
Thank you. Bye-bye.